Thank you. Apologize. Already had shown a few of the slides earlier today, but there'll be more complete information that was shown now on this particular study. Shown here is those that participated in this testing, both from the University of Maryland, from Dr. Senewal's facility, as well as our own Pyrexar engineers. Point of interest as we look at the need and clinical benefit of using radiation therapy with or without hyperthermia and glioblastoma. The current situation, according to SAR, shows about a 21% 2-year survival had been noted, although in recent efforts, it's shown in the bottom, the temozolide plus radiation has actually increased that to 27%. But our motivation is based upon the study of Penny Sneed that was done some years ago, a randomized phase 3 clinical trial in San Francisco, where they showed that when they added conventional radiation and boosted with radiation therapy plus or minus hyperthermia, that we would more than double, approximately double the 2-year survival rate. And we're thinking that adding hyperthermia to the current standard of non-invasive radiation may in fact help us boost that survival rate in a similar way to increase it even more than the current 27% that they're talking about. As shown, this is the array that we're working with, the prototype that we've been testing, operates at 915 megahertz. We have 72 dipoles. They're bow tie type dipoles that are located in 3 rings, operating with 24 dipoles per ring, and a description of the phantom that we're testing at this point. We're using water bolus in this testing. The test setups that we are showing here include both the E-field scanning measurements with E-field sensors and saline phantoms, also heating up test that we're doing with gel phantoms, simulating brain tissue, as well as the testing in MRIs, shown the setup on the right where we have sensors inserted. The BSD 500 system happens to be the system that we're using in this testing. It has 8 channels at 915 megahertz that we have phase control with, and so it makes a very convenient system to use in our early testing. The antenna phase array configuration has been modeled using COMSOL Multiphysics, and this gives you an idea as to how we're doing this with 8 channels and 72 dipoles. We have microstrip power splitters where we configure an array of 3x3 dipoles from a single power channel. As we've done testing with E-field measurements in phantoms and compared that with the numerical modeling, we have shown here is basically the catheters that are inserted in phantoms along this bottom area, and in doing so we can compare the measurements at these locations with E-field scanning with the simulated measurements of the SAR. The dips shown in that continuous plot is where the catheters are, so the SAR calculation shows 0 absorption at the point of the catheters. I should mention that we actually get very good agreement with both testing these SAR points as well as the predicted measurement points. This is demonstrating as well the simulated heat up rate that we were having and the experimental measurements in these phantoms, showing the measurement both in the center focus, which is the high curve, and really good agreement is shown between the numerical modeling and our measurements. Let's see if I can get this to move ahead out there. And also it allows us to make measurements of the SAR. The simulation SAR was basically estimating for this at about 155, and the range indicates the multiple tests that we were doing. Shown here is the SAR prediction, and we evaluated 2 situations numerically, one with a phase lag on the outer ring of dipoles and a phase lead of about 52 degrees. Intentionally, we really wanted to have the phase lead on the outer dipoles, but the first prototypes got built with 52-degree phase lag, which unfortunately wasn't quite what we wanted, but we went ahead and testing that anyway. And so the upper row shows the predicted results from the phase lag configuration. And what that does is it creates a longer distribution along the body length, which we did not want. We wanted to have it more spherical. And theoretically, as we run the calculations with the 52-degree phase lead on the outer rings, that confines the fields down into a more spherical focus, as demonstrated in these numerical studies. We wanted to show you the efforts to prepare for this. Once we had tested this phantom and this array in our lab, we arranged to go to Erlangen and use the BSD 2003 MR system and their BSD 500 to conduct the testing on our prototype. They were kind enough to allow us to do that over a weekend. And to do this, we removed the cover to the MR so that we could insert another notch filter that was actually inserted to block the 915 megahertz from the MR receiver. And on the treatment platform, we can see that there's the head applicator line on top of the platform there. This basically is showing the setup on the left, where we had just inserted the coaxial filters that prevent 915 from reaching the receiver, and then the invasive temperature sensors in the gel phantoms. We showed this earlier, but this is comparing the simulations with MR measurements of the temperature change from a 3-minute heat-up test. And this image on the left is the image from the MR Sigma Vision program, showing focal size of approximately 4 by 2 by 2 centimeters. The predicted pattern that we calculated on the right matched very well what we had expected. In part of the study, we wanted to not only demonstrate the feasibility of focusing within an MRI, doing the heating within the MRI aperture, but we wanted to demonstrate steering as well. This other view, however, looks at the other view of that other plane of that particular test to show the long axis focus of the phantom. Same focus, same test. Now we positioned the phantom vertically inside of the aperture, leaving the phase focus the same, knowing that the focus will remain in the center of the array but move with respect to the center of the phantom. So on the left is what we observed with the MRI, and on the right is what we had predicted with our COMSOL calculations. You can see they agree quite well for crude initial testing of this capability. Electronic phase shifting is also something that we were wanting to look at, and we knew in our early studies that limited to an 8-channel power system and phase control system, there's a potential of effects from steering that may not be as good as a larger number of control channels when we do electronic phase steering. And so this is an example to see, okay, what do we get if we do electronic steering for approximately 18 millimeters off center, and compare that with the numerical predictions, and that's demonstrated on the 2 images on the left. The diagram on the right basically just shows where we have the phase lead set for the steering of these respective 8 channels. Good agreement was obtained, as shown. We also tested phantom filled head structures. A plastic head structure was filled with these gel phantoms, and you can see kind of the positioning of how that would go. This was showing the resulting images that we got from that. On the left, we have the centered focus, and then on the right, we have the electronic phase shifting to the side about 2 centimeters. And you can see that spot moving over as we had expected. The numerical modeling we're using is demonstrated here. We've reported this earlier last year, but it's a model that anatomically models all the various tissues that we can come up with in the head, with ventricles, gray matter, white matter, skull, eyes, you name it. And so it's a fairly accurate model to evaluate each of these different tissue areas. We can model the perfusion in each zone, as well as place artificial tumors in locations. And with that, this is some of the early work that we had done where we targeted two different positions. One was a 3 centimeter offset to the side, where we show two planes on that, as well as the 3 by 3, where we go 3 to the side, 3 towards the top of the head. You'll notice that with this 8-channel system, we were predicting some additional heating away from the hot spot. Again, the maximum was modeled to be 45 degrees, and this was something that we thought was limited, partly because of not only the 8 channels, but we were not doing any power optimization at this time in our models. During this time, we had also compared multiple channels, 72 channels, 1 channel for each antenna versus 24 and 8, again showing the same behavior with the 8 channel. We haven't shown this before, but we also have begun to conduct power optimization in our numerical modeling. And in this case, we had that same example of the 3 by 3 offset steering that had some additional heating in other brain tissues, where you can see we've actually reduced the power level to various lower percentages on the channels that are away from our intended hotspot. And in comparing the left without any power balance with the pattern on the right, you can see that it eliminated the excess heating that we were getting in the brain to levels about 39 degrees, where in our hotspot target, the maximum was about 45 degrees, limiting the focal region of our target to about 41 degrees on the perimeter. So in conclusion, the 3D MR and the single dimensional thermometry of our probes validated the numerical simulations. The phantoms confirm reliable and predictable steering focusing by both phase and positional steering. Certainly the 24-channel system shows better phase steering localization than the 8-channel, but we're beginning to see that even by adding the the current study has mainly been because of phase steering, but these recent steps using power optimization is showing that the better focusing can be obtained even with the 8-channel system at this time. Whether that will be the final configuration or not, we're not sure, but the feasibility of the heating small targets in a head phantom using novel microwave brain applicator is demonstrated here with both experimental and numerical simulations. And would like to acknowledge again the participation of the University Hospital of Erlangen to allow us to use their system for these tests. As you know, that's a working clinical system, and we had to be very careful not to do anything that would interrupt the system's operation for the following week's use. And so in this particular testing in the MR, we did not simultaneously operate RF power while we were doing imaging like we normally would have. To do that, we would want to have a series of extra steps to very carefully check out signal noise degradation. So we were doing these tests inside the MR aperture, but we were not simultaneously imaging at the same time our RF power was on at this particular series of tests. So thank you for your attention.
Thank you very much for the presentation. We have time for one quick question.
I can speak up loud, and that is fine. Do I understand it correctly that you took only one slice of your MR thermometry in order to, because you measured after, you said after you took off the 915 signal and then you did the temperature measurement with the MR? Because there's little noise in your picture. It is so sharp that I think you must have had a superb MR.
Well, of course, we actually did scan many scans on different slices, but it's just not enough time to show all of that result and that data. But even in these other slices that we're not showing it did agree quite well with the numerical predictions of those other slices. So we felt fairly good about that. Noise level, keep in mind, we're using the body coil, not a head coil, in doing these tests. And so the signal noise is not as good as we would have if we were able to configure this with a head coil or a smaller coil around that device. So the purpose was really to demonstrate the feasibility of doing this, not necessarily to optimize the signal noise in the MRI.
Thank you.
Thank you for the question.